this episode of Horse Shelter Heroes.
So we don't know how many horses we're gonna get tomorrow. 50 and maybe 90?
We have no power, which means we don't have any lighting.
MLEC's here. Just came out to talk to them. They have 7 poles they're gonna be running the power.
At least 3, maybe 4 auction tags on. So this guy's just been dumped over and over again.
So a storm blew up, wind gusts up to 40 miles an hour.
We had 2 cases present today with a condition that I've never before seen in clinical practice.
This rescue mission has been wild. The last group of horses are pulling in 77 total.
You don't want to miss a single second of Horse Shelter Heroes.
This is the 4th week of June and we're getting ready for our buyout week. It's going to be such a busy week and we're already projected almost 60 horses this week.
So my internship around at Horse Plus has been pretty great. So I got to do a lot more hands-on training with horses like I've been wanting to do, and I also learned a lot from our vet team. So I can now go back to Arizona and hopefully use what I've learned here back with my aunt's nonprofit, and hopefully we can work out better. And also with the vet staff, I got to sit in and spay and neuters. I got to help out a lot with vaccines and everything, so it really was an eye-opening experience and I learned a lot from this experience. And I will hopefully return around in July sometime, so I'm hoping to come back and work longer hours at Horse Plus.
I am counting how many tubes of Quest Plus we have. So we don't know how many horses we're gonna get tomorrow. We could get somewhere between 50 and maybe 90, so that's kind of difficult. If we do end up getting 90, 2 of them will be slaughter trailers, and sadly they're probably going to be in pretty bad shape. So in my head I'm hoping we'll fully intake, if there's 90, like 70 of them. Well, I'm going to go ahead and try to count out 70 of these. That may be hoping high, but hallelujah that Horse Plus is able to help so many horses, hopefully this month.
So Caitlin has so wonderfully packed everything that we can pack today. Some other stuff that has to stay refrigerated is gonna stay in our fridge until tomorrow, like our vaccines and things like that, but we're all ready for buyout tomorrow.
We have no power, which means we don't have any Wi-Fi, any lighting, no internet, and it also means that we can't do blood work. So we're a little in the dark, so to speak, over here.
I'm doing fine. Keith and I are working on some paperwork over here, and we're just shining our lights so that we can see what we're doing and shining some stuff. Getting everything ready for buyout. This is the day. We have more horses than we have ever rescued, possibility today. So of course the day is full of challenges already. So hey, but you know, it's all awesome, part of rescue work, and we're just gonna keep hitting the ground like our team always does, and we're gonna get stuff done.
So somebody hit a pole, boom. The power went, and now we can't do our jobs.
We are putting signs on our buildings around the property so that people know which building is which.
First we thought it was exciting because the installation guys came and they're gonna be insulating the education center today. And then somebody came back to my office, they're like, MLEC's here. Just came out to talk to them. They have 7 poles they're gonna be running the power all the way up the back of the property line behind me, all the way over to the intake facility where it's gonna be climate controlled. So super exciting. They're like, we have 7 poles to set. I don't know what's going on, but it's a very, very ridiculously busy day today.
So we're up here up in quarantine. It's buyout day. We're expecting between 70 to 90 horses, depending on how many show up. So we have all of our stuff ready, and we're gonna try and organize and get through as many horses today as we can.
I didn't want to be without you. I guess I thought you'd read my mind.
This poor horse clearly has a lot of congenital issues. He's got a wry nose, which is a deviation of the maxilla and mandible. He either suffered a pelvic fracture or has congenital, but it looks like an old fracture. He's got severe atrophy on the left. He's got deep suspensory limb desmitis in all 4 of his limbs, and it looks like he's also got chest wall and lumbar spine deformities. Poor little guy. He's got a snotty nose. He's trying to be good, but he clearly doesn't know what to do. And he's got at least 3, maybe 4 auction tags on. So this guy's just been dumped over and over again. Perfect. This sweet little boy, we sedated him. He's in really, really rough shape. He has this big, deep wound over his poll. He has rhinos, which is a congenital malalignment of the maxilla and mandible. It's pretty minor. If his rhinos were his only problem, we definitely would be rooting for him. He's got some pretty severe lung sounds going on, but he also has pretty severe, what appears to be a congenital abnormality of his neck. And the deviation is so severe that his spine is pushing his trachea and esophagus kind of down to a manner that they shouldn't be. We didn't take radiographs of his legs and feet, but you can see, even though his hooves are overgrown, the angle of those hooves being laid on the ground is very abnormal and indicates tendon laxity. So that probably is also congenital, probably has been the case since he was born. And then he has kind of a roach back appearance where he's hunched over and's got some abnormalities in that spine. And then when you look at him from behind, his pelvis is very abnormal and uneven. The left side is about 3 inches lower than the right side. Poor little guy has at least 3, maybe 4 auction tags on him. He's very sweet. He doesn't know anything. He doesn't know how to walk on a halter. We did immediately give him some pain medications, and he had some sedatives. He had a very, very light dose of a sedative for his radiographs, and it was too much for his little body. So he's very sleepy right now, but it's just heartbreaking. This is likely the result of poor backyard breeding and then not doing the right thing. Tendon laxity is something that we can address. We might have been able to splint or improve his neck when he was younger, but he has really advanced abnormalities and he's probably in a lot of discomfort. So we are going to recommend the last act of kindness for this poor little boy. It's kind of the culmination of a lot of things. My biggest concern are his legs and feet. You can see how hard it is for him to stand. He was almost down on his knees in the trailer. So rhinos is something that horses can definitely live with, and so are congenital top line abnormalities, but his legs and feet are causing him discomfort with every step, and I think even with pain management, his prognosis is very poor.
So this is a small pony. Well, not really small pony, but it's a pony. And she appears to be between 12 and 15 years old. She is completely blind, it looks like, but we haven't really done a thorough examination yet. And I think Dr. Lydia is about to come over here and do that.
This gorgeous little pony mare is only about 12 years old. It looks like she may have just weaned a foal. She's completely blind. Her left eye is enlarged and painful. Her right eye is shrunken. So she looks like she has pretty advanced anterior uveitis. It's one of the most common causes of blindness. We see a lot of blind horses. She has about a grade 3 heart murmur. She's very, very dehydrated. And she unfortunately also has evidence of founder rings in her feet, as well as active digital pulses in both front feet. So we just gave her some pain medication. She's being kind of pushed around by the other horses. She's very small and can't see at all. So we're putting her in a stall. We're gonna let those pain meds kick in and I'll recheck her heart rate. I am very concerned about the possibility of active founder as well as cardiac disease. Poor little thing, you're okay. This beautiful boy, we think is a standardbred or standardbred cross. He's covered in ticks. He has a pretty severe left hind limb lameness, And on palpation, he has crepitus and abnormalities palpable over his stifle. So we're taking stifle radiographs to see. He's only about 7 years old, and he's a very good boy. Handsome boy has a pretty severe left pelvic lameness. I'm hopeful that it's just soft tissue. We didn't see a fracture, and so we're gonna give him some rest and probably some anti-inflammatory therapy and just evaluate over time. I was worried that he was neurologic, but on closer examination, it looks like it's just a straight up soft tissue lameness, so prognosis for that is much better. He is only about 7 years old, so I'm hopeful for him. He's gonna need more advanced lameness evaluation, and soon we'll have our new ultrasound, so hopefully we'll be able to evaluate him more thoroughly with that. Our first group of 11 horses, only 2 of them were in condition that we're able to treat them. So we're thankful that we saved those animals from having to travel to slaughter and die in an unethical manner in 100-degree heat. But it's been a tough morning for our team. Had to make a lot of hard calls. Just finished intaking 11 horses, and we're gonna take a quick break, eat some lunch, cool our bodies down a little bit, and come right back up in time for our next load of horses.
We are asked to help hundreds of animals every single year. We cannot do that without your support. Being on the front lines of animal rescue, we see things that break our hearts. It's through donations that we're able to say yes to not only horses, but dogs and cats as well. Every animal deserves a second chance. At Horse Plus Humane Society, the plus in our name is for every other animal besides horses that needs help. And we help thousands and thousands of animals, but we can only do that through support from people just like yourself, donating to help us help the helpless. If we don't have support, we cannot save these animals. Please make a donation right now and be the difference for an animal in need.
All right, so we're back up in quarantine after lunch. 2 trailers just showed up and unloaded their 2 loads of horses. We have over 20 horses right now to go through. So we're trying to get the first one into the chute. We're gonna take Wither Rads over because she's got a wound that she's really reactive to over that Wither point. So we're just waiting for the radiographs to be set up. We took Wither radiographs to check out this lump and the asymmetry. There is soft tissue opacity change there. It does go to the level of the wither top of the spinous process, but it doesn't look like it communicates with it, but we'll need to further evaluate. Maybe recheck her in a few days. We took radiographs of some of her major joints, like her carpi and her tarsi, some of her fetlocks, and those all look pretty good. So we're gonna give her a chance to decompress, maybe do a dental, and see how she does. Other than that, her physical exam was pretty unremarkable. We did take some blood to do a CBC chem, so we're gonna run that and see if there's anything major organ-wise that we need to be worried about. But so far, she looks okay.
We had 2 cases present today with a condition that I've never before seen in clinical practice. It's known to happen, but it's a very rare complication of late-term gestation. It's called rupture of the prepubic tendon. So there's a main tendon in horses, and it's especially important in mares, that supports the caudal abdomen, the back part of the abdomen. And whether or not we can trust the history that we got on this group was that they were brood mares, they all foaled. And so these mares, if their babies were valuable, they would have been kept until they fold, but unfortunately there's no surgical fix for this problem, and it can be really painful. You know, you can belly band them and you can give them pain medications, but ultimately all of the weight of that abdomen isn't meant to just kind of rest without the support of that tendon. And so we have 2 mares. I wish I had a bunch of vet students. It's really tragic for these girls because we don't have treatment options for them, but I've I've only read about this in books. I've never seen it in real life. Normally, the linea alba and all of the muscles and fascia of the caudal abdomen work together to hold things up, but the tendons that attach all of that fascia are what are kind of critically important. Like when you have a inner tube in your tire and you have a weak point that kind of herniates out, it's like a hernia, only if the problem is with the body wall itself, often we can sew the body wall back together. But in this case, it's a ruptured tendon and we can't surgically tie the tendon back together. There's no known surgical repair for this condition. So a hernia would have been a better prognosis. In fact, the pictures that we got from these guys, I was hopeful that it was a large body wall hernia because that's something that I've tackled before surgically. These poor mares. This handsome standardbred gelding was very sweet. He let us catch him. He's got swelling over one of his eyes from some trauma and some scarring. And unfortunately, he also has a heart murmur. It sounds the strongest over the aortic valve. So he does have some kind of a cardiac abnormality, but otherwise his physical exam is normal. And because he's in his mid-20s, we're gonna take a much closer look at his teeth and see if he needs any help. His body condition score is about a 4 out of 5, so he's thin, but he's much better fleshed out than a lot of the horses here today.
So I went ahead and searched this horse's brand on ustrotting.com. It's just a website that helps you track horse racing brands after they're done racing, especially cart horses. Found out that this horse was born in 2008 and makes it 16 years old, and its name is Spartan Spirit.
So it is so hot up here today. I personally DoorDashed some popsicles for the team because we need to cool off. It is very, very hot. So we got popsicles.
This little mare, I think she's about 16 years old and she's got this pretty gnarly gash on her side. I'm hopeful that maybe I can get it closed or mostly closed. I might have to sedate her a little bit more, but I need to see what's going on underneath. So I'm gonna clean it up and probably block it with a little bit of a local block, kind of go from there. It's very already dirty and contaminated and I am putting hairs into it, which isn't great, but gotta get all this stuff off. Ari and I just finished debriding and closing the gash on this mare's side. Looks like she ended up needing 1, 2, 3, 4, 5, 6, about 12 sutures. It went together better than anticipated. The wound is under a lot of tension, but we got it clean. We debrided all of the necrotic tissue and hopefully this will help keep the flies from it. It's still a tiny bit open, but it's mostly closed. She's only about 16. That was the only major health concern we had on her, so I'm hopeful that she will heal up well and that we'll get her to her forever home.
Our next trailer is here. I think there's 20-something horses on it. And then we still have another trailer coming. So I don't know exactly how many horses we're at right now, but we've just been very, very busy all day long. And it's still going.
This 4-year-old mare has a history of falling through the bottom of a trailer and scraping up her hind legs pretty bad. We took some radiographs. We're really worried that it communicates with the joints. Radiographs have a very poor to guarded prognosis, but tomorrow we're gonna put her down in the barn, sleep on it, and sedate her heavily tomorrow and see if they actually do communicate, and if they do, then we'll make a call, and if they don't, then we can try. It looks like she could possibly have some gas pockets going all the way to the bone and the joints, maybe a possible fracture too. We need to upload it to the HESCA view and actually look at it in our office. It's really hard to interpret the subtle differences out here in the sunlight. But that's why we're poor to guarded prognosis as of right now.
Yeah, we're up in quarantine. We just finished our first day of the buyout intake. We got through 31 horses out of 57 horses. I lost count. It's a good amount of horses. We got through all the criticals that we could see with our naked eye.
The visual criticals.
Yeah. So everyone else seems stable, and we'll come back up tomorrow and try and finish the rest of them and do further diagnostics on the ones we did today, like the CBC chems that we took, that we need to run, get Coggins out, all that good stuff.
Yeah, the first trailer load was really tough because of 11 of them. We were only able to save 2. And so that's a hard way to start your day. But after that, we've had a bunch of animals that hopefully we'll be able to save. We have one 4-year-old mare down in our vet hospital with severe degloving injuries. And we're very concerned that her joints are affected, but we're gonna try with her tomorrow. This guy needs surgery. We got a lot of animals that need advanced medical care. So we got our work cut out for us, but we wanna save as many as we can.
Really nice to see the horses out in the pasture. We'll be bringing them up tomorrow to finish their intake, but they're stable enough to be able to go out and enjoy hanging out in the pasture and eating tonight. So that's awesome. Everyone's exhausted. I can't wait till the climate controlled intake barn is done. It's gonna make it so much nicer for our staff and the horses. So very thankful to the donor that's wanting to help fund this project, but it's gonna take a lot of support, so you're welcome to contribute as well.
It's so awesome getting it spray foamed. It's already feeling different. Like the thermal qualities of this building have just been increased tremendously. And now, oh boy, we're busy throwing up drywall, get this place finalized, get it ready, get it occupied. I can't wait. I know it's a little bit behind schedule, but just thankful for the work that is getting done, and thankful for the spray foam guys that came in, got it done. Literally, this is day 3 after the bid. So now it's just up to me and the drywaller guys.
My name's Kane. Our company is RBC Insulation out of Hohenwald, Tennessee. And we applied the spray foam in here in this building for Horse Plus. And we're glad they asked us to come do it. And we applied 2 inches of closed cell pretty much everywhere. And then it should keep them from getting too hot and from it condensating, and hopefully they'll be comfortable in here. Glad to get this done.
So a storm blew up, and we were just putting everything away before it got blown away. Wind gusts up to 40 miles an hour, so just trying to get things put away that are gonna blow away.
Today is day 2 of our big rescue mission buyout. Yesterday we got 58 horses. I know there's some confusion because when we're rescuing like dozens and dozens and dozens of horses, it's really hard for us to keep track of the numbers. Our focus is on taking care of the horses, and there's just piles and piles of paperwork. So we have to go through all of that to know our actual numbers. So I think Jason in his video was like, yeah, we got 57 or something, but there's more coming. Buyout is just hang on by the seat of your pants, and we get through buyout, and then we're able to catch up on all the numbers. But we do have more horses coming in today.
So we've got a ton going on this morning. We have a ton more horses to intake, but we took in a very young mare yesterday who had fallen through a trailer floor and really catastrophically degloved both her hind legs, and she cannot wait. So we're about to put her under general anesthesia today. Dr. Gina and Caitlin and Tawny and I will all be kind of doing 2 different things because a lot needs to happen with both of those legs. She needs surgical debridement. We're gonna tap her joints that might possibly be affected so we can evaluate for signs of sepsis in those. We're gonna be using a contrast media to try to take better radiographs. Troy is gonna help us with induction and recovery, and she's got a long road ahead. So this is a complicated surgery, but then on top of it, the aftercare is very, very intense. So she's got a lot of things stacked against her, but our team is gonna give it everything we have and pray that we can save her.
And we're going into this with like a 10% chance that this could work. So this is huge. If we didn't have this facility here and we didn't have 2 full-time veterinarians, like prior to having this veterinarian hospital on site doing an intake and she would have been there, we would have had to euthanize her.
It would never be fair to do this surgery in the field.
Never be doing this in the field or even just the follow-up care. without this facility and without the staff we have. So we could totally be going into this and have to make that last act of kindness call, but because we have the ability here, it doesn't really cost anything more for us to do this other than the drugs. And that 10% chance could save her life.
We're gonna try.
We're gonna try, but we don't know. But that's the beauty of shelter medicine here, is we're able to try. In another situation, without this team and without this on-site vet hospital, we would not be able to do it. It would just, if we took her to another vet hospital, like, I mean, it would be, thousands and thousands of dollars to do what we're going to be doing here. So this is where the beauty of on-site veterinarians and on-site vet hospital is really state-of-the-art for rescuing at this level. So we're going to give it our best shot, and fingers crossed, but we don't know.
We are removing severe contamination of these wounds and also some dead tissue. Need to be at the level of bleeding, vitalized tissue for this wound to have any chance of healing.
Procedure went well today on that really lovely mare. I didn't think I had actually tapped her joint because I didn't see anything in the hub of my needle. But when I aspirated it onto a slide, there was a few drops, which is not super promising because you want joints to have a lot of nice fluid, what's appropriate amounts to lubricate the joints. So there are a few drops, and I have stained it. I haven't been able to look at the whole slide thoroughly, but I just looked at it quickly enough to see that I actually did get joint fluid, which I was really surprised about. But what I did see was some synoviocytes and one mononuclear cell really quickly, which are what's supposed to be in the joint. But we're gonna have to look at her rads closer and look at those slides a little bit better when we have more time after our intake of the rest of the horses today and see if we can see anything else.
We finished doing surgery on the little mare that fell through the trailer. That all went well. This morning she's in recovery in her stall, and we just loaded our intake supplies back up. We're gonna head back up to quarantine and keep intaking horses. We have a ton of paperwork from yesterday, including blood samples that need to go out. So Dr. Gina and Mari are gonna stay down here and make sure that gets done. And Caitlin and Troy and I are headed up to quarantine to work on intaking horses.
This morning we have some sadness. Yesterday this donkey was perfectly fine, and he followed me around, and he is extremely sick today. And this is that donkey disease, and he was with the other donkey, and there are other donkeys that came with this group, and I think we have more donkeys coming in today. So when donkeys are in the slaughter pipeline at auctions, they get this and it attacks their lungs. And yesterday he was fine, happy, looked completely normal, and today he has it. So we're gonna have to give him the last act of kindness. The donkey did have that disease, and when he was humanely euthanized, did a necropsy, and he actually had ruptured like in his lungs, and there was just blood coming out of his nose actually from it. This disease that donkeys get is prevalent. It's very contagious. The other donkeys that came with him are probably be gone as well. We can hope and pray that they'll be okay, but we don't know what this disease is. And like yesterday, that donkey was fine. I was even thinking like, I could take this little donkey home. Like, he was so sweet and like personable, and then he's a very, very sick donkey the next morning. And Dr. Liddy said with the amount of blood that he had in his lungs that he would have been gone within hours. So it's really hard and not what we wanted to start the day off with, but we got a lot of horses to intake, and it's time for us to get busy.
This adorable little Jack donkey is about 3 years old. He has a ton of scars on him. He's still intact, so we'll schedule him for a castration, but he's got a lot of scars and a lot of evidence of sun irritation on his non-pigmented areas. He's got a really big rash up here by these ears. So this is wound cream that has zinc oxide in it, which is a sunscreen as well. And we just don't want to turn him out and have him not be protected.
This is EquiSpot. We love EquiSpot. It lasts 2 weeks compared to fly spray. We're able to do this during intake, and then they have relief from the flies for 2 weeks, which is very nice. While they decompress, they don't have to worry about the flies.
No, thank you. Oh, baby.
Baby. Oh no, it's a baby. Let me see your nuggets.
It's an arrhythmia. Yeah. It does. Sneakers in a dryer is the perfect description.
So this roughly 20-year-old mare, based on her dental exam, one side of her mouth shows a different age than the other, so we just went with 20. That's the oldest of the teeth. When we're listening to her heart, she has an arrhythmia that sounds similar to sneakers in a dryer. So if you can imagine what that sounds like, that's what she sounds like down here. But we're going to re-auscult her when we do her sedated dental and do some more radiographs and things like that to further evaluate her.
This is Quest Plus. This is horse dewormer.
This little gelding has been super duper sweet, seeking out attention, very easy to catch. He's got a ton of scarring up under his neck. I suspect that somebody tried to treat him with some IV medications and missed. It's called extravasation of the drug. He's got really big wound up here over his withers, so we're gonna take radiographs of this area to make sure we don't have any major fractures or gas pockets or anything like that. And then we're gonna clip and scrub this up really well. I'm hoping that it's just an injury and not, there's a condition called fistulous withers where they can get really deep infections up here. But it looks like he had a bunch of other wounds that somebody sutured up in the past. He's got a bunch of scars back here. So hopefully it was just an injury that didn't get the care that it needed. But he's a very sweet boy. He's about 18. So I'm hopeful that we can get him healthy again. This is why we clean animals, because this is the first one we took and all of this looked like it could be bony proliferation, and it was just external surface debris. Yay. So in 2 minutes, our prognosis got better. I still don't love that this little gas tract is here, but I vote we try. I am gonna use this antifungal, antibacterial, antiviral wound cream. It has an insect barrier. It's got all kinds of good stuff in it. Lanolin, beeswax, calendula, grapefruit seed extract, fennel seed, eucalyptus, leaf oil. We had somebody donate some of this to us. I had never used it before. I love it. And whoever it was gave us more, and we love it and we use it all the time. But it's just a really nice, gentle wound ointment. It also provides sun protection. So we don't always think about UV, but UV can be very, very damaging to this baby granulation tissue. We have a ton of blood work to run and blood tubes to process and a ton of paperwork to do to get these Coggins tests out tomorrow. So Mari is our brilliant young computer whiz, and she's been helping me. She and I are gonna go down to the vet hospital and get some blood work started. Dr. Gina and Caitlin are gonna keep rolling with vet exams and processing of our horses up here.
I believe this horse was once a big lick horse. He has, his tail tendon has been cut. And poor guy, he's extremely skinny. So they should not be able to do that in natural horse tail. But for doing performance big lick horses, they cut the tendons in their tail and put a harness up. And his tail tendons have been cut, indicating that he was a big lick performance horse. He's an older gentleman, probably around 20 years old based on his dental evaluation. You can only say the horse has the mouth of the age of. I don't know how old he is per se because I don't have his papers, but based on his dental exam, he's about 20. His heart and lungs sounded okay, but he looks like he, at one point, had a really crusty neck, so he probably was fat, like a metabolic horse, because his crusty neck hasn't gone away.
So we would like to take rads of his feet if we were gonna think about keeping him for a long time, but because of his age and he does have some mild pain on his back on palpation, the last act of kindness is probably the best thing for him because we don't want him to continue to deteriorate. He has lost a lot of weight, and if he used to be fat and now he's really skinny, that's a concern. So we just wanted to do the best thing by him. Everyone talked about it, and that's what we concluded.
So this is a 4-year-old gelding. He needs some hawk rads later on. He's stable right now, very cute, and has potential to be a great horse for someone. So we're going to, I guess, put him on ice, let him relax, and then pull him in later on once some of the chaos cools down, get some rads and see if he will be rideable or not. Everyone loves a handsome pasture pet, so either way, he should be okay.
Put him in too.
This rescue mission has been wild. The last group of horses are pulling in. This makes 77 total. One guy who usually always brings 20 horses brought 11, so otherwise we've been closer to our original goal, but 77 over 2 days is amazing, so thank you.
All right, so we're up here finishing up in quarantine for today. We'll have to come back and do another day, but we have these boys moved. We have photos and blood work on everybody we could do today. We still have a few to do tomorrow, but we're gonna go down and run those blood works and do the chemistries and everything and get everybody's coggins in and start again tomorrow.
I'm heading out to pick up a horse that somebody needs to rescue, and I'm pretty sure I know how to get there. I looked at the directions. Unfortunately, my GPS quit working, so I'm gonna have to try to go off my memory, but I should be able to find it. I think, yeah, turn left here. It's dirt road. I think I know where I'm going. It was pretty simple directions, but here's another T, and I really don't know which way to go. I guess I'll call them and ask. No signal, you gotta be kidding me. Maybe there'll be signal outside. There's just no signal here. But I have a satellite phone with me, thanks to sat123.com.
That's right. If you go to sat123.com Horse Plus and get one of these life-saving devices, Horse Plus will earn a commission, which will help us save more horses.
With the power of satellite communication technology, you can reach anybody in the world from anywhere in the world. I'm gonna call them up and we're gonna go get that horse.
This amazing satellite phone, with its small yet powerful form factor, delivers trusted, rugged, reliable communications all in an easy-to-use handset.
And again, thanks to sat123.com, I was able to get out of a sticky situation and go get that horse.
Remember, if you go to sat123.com Horse Plus and get one of these life-saving devices, Horse Plus will earn a commission, which will help us save more horses.
So we are all packed up and ready to head up to quarantine this morning. We have 19 horses that are still in need of intake. 19 out of 77 is pretty good. We've been very, very busy, but we still have a lot more to do. So the vets are ready, I'm ready, our media team is ready. Let's go help some horses.
Dr. Gina and I were able to confirm that neither one of the mares with prepubic tendon rupture were pregnant, which is a relief. The condition isn't fixable in any way. It's progressive, it's painful, and it can be life-threatening during pregnancy for both foals and mares. So our biggest fear when those ones came in was that there was a foal in the equation, and there was not in either case. We were able to do some research and found out that at least one of the mares had been used for embryo transfer. They were both standard bred mares. So that's basically being a horse surrogate, where animals with more valuable genetics, they make embryos and then they implant those embryos in usually bigger mares that are good at pregnancy and raising foals, but that don't have valuable genetics. So both of those ladies had extensive scarring of the vulva and vagina and very used cervixes. So I think it's safe to say that both of them had a lot of foals. And then, so I had never seen this condition before ever in more than 10 years. I've only read about it. And so we wanted to be respectful for these ladies and learn what we could. So we were able to do necropsies on both of them. And we had a few different findings, but a lot of similarities in what we found. You want to talk about?
Sure. They both had extensive ascites, which we kind of weren't super expecting, and both of them were icteric or jaundiced. One mare was significantly more than the other, but they both had that. They both had necrotic bowel and injected bowel, and the second mare that we did had really firm hemorrhagic nodules on part of her intestines. So it was definitely the right call for those two mares, and we're really thankful that they didn't have any foals involved.
Yeah, I was very surprised. Like, in my mind, this is a mechanical issue. And ascites, when we have fluid building up in the abdomen, indicates usually kind of like end-stage organ dysfunction, where you're leaking fluid into your abdomen. And so they both had a pretty extensive ascites. And then the icterus indicates end-stage liver failure. So one of them was much more severe than the other, but they both had indications of advanced liver disease, and that one of them was 16 and the other one was 18. Both of them had pretty horrible teeth. So it's always nice and also hard when we can confirm known ages, because I aged both of those mares in their 20s based on their teeth, and then we confirmed that they were in their late teens. So that's not a huge difference, but I think they had pretty tough lives where they weren't cared for. So it's hard to lose them, but I think the most respectful thing we can do with these animals is to learn as much as we can from them so that we can be better prepared to treat any subsequent animals that we see.
So this little 3-year-old donkey, we are going to give him a chance. He has some strange hind end thing going on, but it's not neurologic. He passed all of his tests. So we're gonna hold on to him for a little bit, see if the hind end issue improves. But for now, we have fully intaken him, and he is ready to go out to a pasture and hang out up in our quarantine area.
So this little donkey looks like he's been getting beat up quite a bit out in his pasture, wherever he's been. He does have a cut up here by his ear, but he is good to get everything. He does not have a fever. So we're going to give him all the vaccinations, and we're going to send him out, and when we bring him back in to castrate him next week or the week after, we'll go ahead and take a further look at that ear and make sure he gets all fixed up.
What's that on the ear?
Right now I believe he just has some swat on his ear to keep the flies out of it, and kind of help soften up all that hard scabby stuff that's there.
We got a bunch of adorable donkeys and minis, none of whom are halter broken. So in order to keep our process efficient, I'm gonna go down and do a bandage change on our little mare that fell through the trailer and do her first post-op check. So hopefully those areas look good. We are gonna sedate her for that, but shouldn't take too long, and praying that it looks better than it did before surgery.
This is B24294.
This little guy is a 1-year-old miniature pony. He kind of looks like a cow. He's very, very cute. He has a lot of spunk, but that's very common because he's just a baby.
This Jack donkey is about 6 years old. He has some damaged incisors on the left side of his face. He's got a lot of scarring and thickening of his skin, so it looks like he's been in a few battles, but it's not severe. They're pretty mild. So we're gonna try and give him all the things, and hopefully he doesn't come down with the donkey disease that everybody else is getting. Yeah.
We're all done with this donkey. We have, it looks like 2 more to go, and then we're gonna be breaking for lunch. This guy's about to go and join his friends.
So we are officially done with our new herd of donkeys. Everyone is intook and everyone has been seen by a vet in the donkey department. We still have a few horses left. We are starving. So we're gonna go down, eat some lunch, and then come back up and wrap up the last few horses that we have.
I've been on the front lines of animal rescue for over 20 years. I have been going to auctions and I have seen horrible things happen to horses. In 20 years of rescue, nothing has really changed. It's come to the realization that we can't just rescue horses from auctions. We can't just keep rescuing horses out of the slaughter pipeline. We have to stop it once and for all. It's time that a federal law gets put in place, and we are going to Washington, D.C. on a regular basis to try to advocate for horses. What I find in Washington, D.C. is a lot of people have no idea what's actually happening to horses. And I leave these meetings hearing their voices say, "We didn't know that this was so important. Thank you so much for coming and telling us the reality of what's happening to horses." Our advocacy for different acts impacting horse welfare is so critically important. So please donate, help us change the laws for horses on a federal level.
I'm taking these standing bandages off. So we put these on after surgery to provide extra support against swelling, but also because anesthetic recovery can be rough. Sometimes hers was beautiful and very smooth. She laid on the ground and yelled at us for a while because she was mad, and then she stood up on her first try and it was beautiful. But we like to make sure that their legs are extra protected, and in her case, she has so much going on with these legs. And I guess the answer to that is, this is what I learned to do, and so I'm much more comfortable just holding the blade in my hand. Knock on wood, I have never stabbed myself or an assistant with a scalpel. You can see how much strike through we have of this bandage. Those wounds were so dirty. You want compression, you want to keep the area clean, but you also know that you're going to have to change that bandage really quickly because there's always a lot of strike through, and so you put it on knowing that you're going to take it off and you don't want it to stick to the wound. Or I love Manuka honey, but my big complaint about Manuka honey is it's very sticky. So you always have to be aware, and I kind of get around that sometimes by mixing it with something else. Petroleum jelly works really well. We did not confirm that we had communication with the joint, but we also didn't definitively prove that the joints are safe either. So we didn't have to euthanize her. It was not worst case scenario, but she has a ton of healing to do still. So you can see how much cleaner it is. This is all granulation tissue. This flap of skin right here, I almost cut all the way off yesterday, but it was still, part of it was still alive, so I cut to the level of vascular tissue, and she may need another resection later. So I wasn't sure we were gonna be able to do hydrotherapy today, but it looks, based on that leg, it looks really good. I think I would maybe like to do some hydrotherapy. This first bandage change is often painful because actually there's not a lot of blood, but sometimes the blood like cements the bandaging material on and you gotta pull it off. And it's gotta feel good not to have 8 million flies all over your wounds, you know? I mean, just that by itself feels like a positive change for her. I am pretty happy with how this little mare looks day 1 post-surgery. Her wounds are way cleaner. They are extensive. I do think that she's probably gonna have to have another corrective surgery, but for day 1, I'm pretty happy. Emily's doing some hydrotherapy. We used chlorhexidine, our surgical scrub, to clean the leg additionally. And then I'm gonna use a couple different products on these areas, and people donate medical supplies to us all the time. I wish I could remember everybody's names, but we've had roll gauze donated, we've had nonstick Telfa pads, we use this medicated wound cream. This woman named Kathy in Florida sent us this redox gel that I'm gonna try for it, but we're so grateful. You don't think about bandaging materials being that costly, but the components of one bandage for one leg are probably close to $25. So one bandage change for this mare is like $50 worth of materials. And I would say more than half of that I'm able to use donated things. So thank you guys for letting us do this. This mare is gonna need advanced medical care for a really long time if she pulls through. So we're gonna combine a couple different things. My big concern right now is that we don't want it to stick to this wound, but also, the more we pull our bandages on and off, the more we disrupt those clots and scabs. So I'm hoping that with this bandage change, we can leave it on for more than 1 day and give that fragile tissue a little bit longer. So I'm gonna be really, really careful with how I put this bandage on. We are wrapping up doing this little mare's day 1 surgical post-op. I'm really happy with how everything looks. We did about 10 minutes of warm water hydrotherapy and scrubbed with chlorhexidine, and then dried everything off. And then I used some different topical wound products, a nonstick Telfa pad, and then some roll gauze for absorbency, vet wrap, and then we're gonna finish up with Elasticon. She seems really comfortable. Her heart rate's been very stable. She's eating and drinking really well. Her anesthetic recovery was perfect. So those were all big concerns. She also had very, very low platelets, probably because she bled a lot from her injury. And so she wasn't a great surgical candidate, but we went for it anyway. And thankfully, she didn't lose too much blood in surgery and everything looks really great day 1 post-op. So overall, I'm pretty happy. We're definitely not out of the woods. She has a very uphill climb in front of her, but she's not septic yet, so we're gonna give it our best go. She's on systemic antibiotics and systemic anti-inflammatories, and she's a very good girl. So this is our little mare who fell through the trailer floor. She had her first bandage change after her surgery yesterday. It went very well. She still has a long road to recovery, but overall I'm happy with her progress. We didn't want to do too many things at one time yesterday, so we held off on some of her core vaccines, but she is young and susceptible and came through a slaughter auction. So she got her rabies, 5-way, and strangles vaccines, and we also gave her a microchip today. And she's about to go back to her stall.
So we're back up here after lunch, finishing up the rest of our quarantine group. We have quite a few Mustangs that are really, really pretty and we're really excited about. But after that, we should be through everybody.
So this Mustang here, we checked its brand and it appears to be about 9 years old based off of what the BLM has said and what they put on his neck. Looking at his teeth though, he looks like he's closer to maybe 11 or 12, but we're gonna go ahead and go with what the BLM said and call him 9 years old. This is a strangles vaccination. I didn't even do it yet. You know what it is?
Thank you does. He's smart. Smart guy.
Oh, there we go. This is a Mustang. Based off the brand, it's 2 years old. Its teeth look even younger than that though. But with how young this animal is, I doubt it's actually a titled Mustang. I'm going to assume that this horse is untitled, so it would need a BLM process to adopt, but we're not 100% on that yet. We'd have to do some further research to see if it's registered or not.
So the little filly that we just got done with, she's a little Mustang, about 2 years old. She had some nasal discharge, and when I listened to her lungs, I heard increased inspiratory noises, but not anything else, no crackles or wheezes or sounds that would make me think she has like pneumonia or something like that in her lungs. So she didn't have a temperature, so we went on and gave her all of her vaccines today to get those on board, so that way she's protected against other things. But other than that, she just had a little droopy lip, and it's going to be up to the training program. So this is our last horse that we were doing up here in quarantine. He's the 5-year-old Mustang based on his brand. He seems like a really healthy boy, so he got all the things, and he's just ready to go whenever somebody can take him out to Q2 or Q3. So it is our final day of buyout week, and we've gone through everybody, and we have a total of about 77 horses come through this week, which is amazing. It's the biggest we've had so far yet. We had a lot of heartbreaking cases, a lot of ones that you could just see getting off the trailer immediately that we're like, we need to take care of them right now. And then we have quite a few that we're hopeful about. We got a lot of donkeys, so we'll have a lot of castrations in the future coming. But yeah, it's been a good week, hard week, but we did a lot of good.
Just want to wish you a very, very happy 4th of July. Growing up, 4th of July was a huge holiday for me because our little town had a little parade, and I would take my animals through, my goats, my sheep, my pet emu. 4th of July is a really fun holiday, and I hope that you have a wonderful, wonderful 4th of July that's filled with friends and family and fun and your fur babies.